All right. Well, it looks like we are finished dialing out there, and thank you to all of you who are taking time out of your day to join our Madison VA Teletown Hall. My name is Abe Rabinowitz, and I'm the Assistant Director of the hospital. I'll be moderating the call this afternoon, and today we're fortunate to have a panel of Madison VA's leadership team here to answer your questions and provide you with updates. This includes our Acting Hospital Director, Christine Kleckner, Chief of Staff, Dr. Ryan Marsh, Teresa Edgren, Associate Director for Patient Care Services, Rochelle Carlson, Chief Primary Care, Randy Carter, Chief Nurse Primary Care, Crystal Warning, our Chief Planning and Strategy Officer, Margot Edge, our LGBTQ+ Veterans Care Coordinator, Liana Torres, Chief of our Patient Administration Service, and Danielle Barth, our Homeless Service Coordinator. We really do hope you stay on the line with us this afternoon, and we encourage you to participate in the question and answer session that will follow some brief updates from the facility. If you'd like to ask a question, all you have to do is press 0 on your phone at any point during the call, and you'll be connected with one of our staff people who will be taking your questions and getting you into the queue to speak with our panel. The question and answer session will be toward the end of our call, but you can press 0 at any time to get in the queue to get your question in line. If you did get cut off from this call, unfortunately there's not an easy way to rejoin, so please stay on the line. We like to start these town halls off with a message from our Acting Hospital Director, Christine Kleckner. Christine.
Thanks, Abe, and thanks to all of you for joining us on the call today. Today we have a few important updates to share with you. First, we want to talk to you about leadership changes at our hospital and clinics. Since our last town hall, our former director, John Rohr, has officially retired. We are so grateful to Director Rohr for his more than 30 years of service to Madison veterans. With John's retirement, Alicia Miller was named as our interim director for up to 120 days. Ms. Miller is the permanent associate director at the Wichita VA and has held a number of positions at VAs across the country and at VA Central Office. We are thrilled to have her join our team during this time while the search for a new permanent director is underway. Also, since our last Teletown Hall, we have a brand new VA Chief of Staff, Dr. Ryan Marsh. He was appointed Chief of Staff on May 8, 2023. Dr. Marsh is very familiar with our hospital and clinics as he has held a number of different positions on our clinical team since he arrived in 2002, including service in primary care, hospitalist service, emergency medicine, compensation and pension, and environmental health. We are so excited to have Dr. Marsh as our 9th Chief of Staff. Also, we were honored to host VA Secretary Dennis McDonough at our hospital last week. The Secretary took time to meet with our leadership, talk with select staff and our union partners, and toured our facility. During his visit, he also awarded several of our outstanding staff with coins to recognize their service and met with a recent double lung transplant patient and a 99-year-old World War II veteran on the anniversary of D-Day. It was an amazing visit, and we were so proud to be able to share some of our successes with him. He left us with some important reminders and priorities, including encouraging us to strongly promote the PACT Act and new eligibilities for veterans with toxic exposures. In the spirit of servant leadership, he also asked what he could do for us and agreed to help us identify ways we could better connect to unenrolled veterans. One of those strategies was to encourage all of you out there to share your experiences with our veterans who may not be connected with VA and encourage them to explore their benefits. We exist to serve all who serve and want to extend our services to as many eligible veterans as possible. I'm excited today. We have several subject matter experts on the call to share updates with you. We have, first, an update on our masking policy from our Assistant Director and Moderator, Abe Rabinowitz. We have updates on our East and Baraboo Clinic expansions from our Chief Strategy and Planning Officer, Crystal Warning. We have a staffing and service update from Chief Primary Care, Rochelle Carlson. And we have a Pride Month update from our LGBTQ+ Veterans Care Coordinator, Margot Edge, and we have a PACT Act update from Dr. Marsh. So thanks, Abe. Now back to you.
All right, well, thank you very much, Christine. And I will take this opportunity to provide a brief update on our masking policy. As many of you and many of us have long been awaiting, we received guidance from VHA on May 30th that we were authorized to loosen our masking requirement at our hospital and clinics. Effective on that day, masking became optional at all of our CBOC locations and at our main hospital in all areas not considered high risk. High-risk areas where masks remain required include the infusion clinic, emergency department, late clinic where we do our COVID testing, our cancer treatment center, and our Bluffs clinic. In all other areas across the hospital, masks are now optional. We do ask, however, that anyone who has COVID symptoms to help protect others by continuing to mask while in our hospital and clinics. We can all say that it's a tremendous relief to be at a juncture where we can move forward after more than 3 years of management of the COVID crisis. With that said, we want to make sure that all of our patients who are immunocompromised or otherwise concerned about COVID know that they are continued to encourage to wear masks, to include any N95 masks at their discretion, and to consult with your provider about any specific COVID health concerns. So that's what we have as an update for our masking policy. Next, we have an update on 2 exciting new initiatives that will bring expanded services to veterans to the north and east of Madison. I'm going to turn it over now to Crystal Warning, our Chief Strategy and Planning Officer, for an update.
Good afternoon, everybody. As some of you probably saw on the news, we broke ground on the new Baraboo VA clinic yesterday. This new clinic will be located less than a mile from its current location at 414 State Highway 136, of course in Baraboo, zip code 53913, and it's next to Anytime Fitness and across from the BP gas station. What makes this clinic extra exciting is that it will be twice the size of the existing clinic, going from the current 4,863 square feet to 10,000 square feet. The clinic is going to be staffed by 30 VA employees, and the additional space will be used for another patient-aligned care team or PAC team, and will allow us to add additional telehealth, offer podiatry nail care service, and we'll have a new dedicated lactation room for veterans and staff. We'll also be creating a large space for physical and occupational therapy services and expand the nutrition and whole health classes. We have an outstanding partner in the developer Crowharbor Russell Group, and we look forward to providing more updates to you as construction progresses. And the second clinic that's going to be opening next summer is our Madison East VA clinic. Now, you may also have heard about this since we broke ground last June. This clinic is located at 4904 East Park Boulevard in Madison, zip code 53718. It is located near the intersection of Interstate 9094 and Highway 151 in the American Center development. The 30,000 square foot clinic will offer access to specialty services that some of you, especially those of you who received care at Beaver Dam, would find more convenient to access than coming to the main hospital campus. And more information about these specialty services will be coming early next year once we get closer to opening. The clinic will provide the following services: primary care, including a dedicated women's health patient-aligned care team, physical and occupational therapies, mental health, telehealth, blood draw, radiology, x-ray, and whole health services. After East Clinic's opening, parts of the West Clinic are also going to be remodeled, and remaining services will include 5 patient-aligned care teams, as well as a women's health patient-aligned care team. West Clinic will expand to include more whole health offerings and will continue to provide blood draw services, virtual care, integrated mental health, nutrition services, and physical therapy consults. We will actively communicate with all of you about changes to provider locations and options for establishing your health services at our new East Clinic as we get closer to this activation.
Well, great, and that is some really exciting news, Crystal. I know we're all looking forward to these service expansions and to a couple of big activation events next summer. Really, really great. We want to ask the audience a few questions about these expansions, but first I want to turn the floor over to Rochelle Carlson, our Chief of Primary Care, for some brief operational updates regarding staffing for our Beaver Dam clinics. Rochelle?
Thank you, Abe, and good afternoon. In the past year, due to some unfortunate and unexpected circumstances, many of our providers, nursing staff, and clerical staff have either been on leave or have moved on from the Beaver Dam Clinic. And over the past months, we have been managing these transitions as best as we can, but we understand that these types of changes are disruptive, and we appreciate your understanding as we work through these changes. We have some new providers that recently have started and are learning the VA processes. They are seeing patients and will be adding more appointments to their schedules in the near future. We have been committed to continuing to provide access to care while we onboard new staff, but we recognize that these staff changes can be difficult for you as patients, and we appreciate your patience. We are optimistic this new group of providers will stay with us and look forward to returning to a more predictable operating status soon. If you have concerns about your care in the meantime, please do not hesitate to reach out to your patient-aligned care team for support.
Thanks so much, Rochelle. Really appreciate it. And again, thank you to all of our patients for working with us as we manage staffing changes. It's always difficult when we have turnover, and we do our best to continue to provide the best possible services that we can during these times. Before we move on, we'd like to ask you a few questions about our expansions at CBOC. And you can answer these questions by just using the push button on your phone to respond. So the first question is, our CBOC expansions are designed to bring more care to veterans closer to your homes. At our new East and Baraboo clinics, we'll have significantly more care options available so you can more easily receive VA services at VA facilities. With these expanded services available at our new clinic locations, we're interested in whether establishment of these services at our sites will have an impact on your desire to use community care versus VA care. So our question is, with this newer expanded availability of services at Baraboo and East Clinic, would you press 1 if you are more likely to choose VA care if you're eligible for community care, press 2 if that will not change your choice to use community care, or press 3 that these would make you less likely to choose VA care if eligible for community care. So again, if you'd be more likely to come to us for our care versus community care, press 1. If this doesn't really change your opinion, press 2. If it makes it less likely that you would come to us for care if you could choose community care, press 3. Thank you all for responding to that. It looks like for many of you, this will make you more likely, which is exactly what we're after. For a lot of others, there won't really be a change, but we'll hope to convince you to come to us versus community care. That's part of the work that we have to do, and only a very few of you are saying that this would be less likely. So thank you very much. And our second question has to do with the opening of our East Clinic, and specifically for veterans who receive their care at Beaver Dam, our West Clinic, or our main hospital. With new and expanded services at a brand new East Clinic, how many of you are likely to seek services at our new East Clinic versus your current location? If you are very likely to want to receive services at East, press 1. If you're not sure, press 2. And if you're not likely to want to receive services at East, press 3. So if you're likely to want to come to East, press 1. If you're not sure yet, you can press 2. And if you're not likely to want to change your care location to East, press 3. And again, really appreciate so many of you responding with this feedback. It's about a third each. So many of you are very likely to want to come to East. Some of you aren't quite sure yet. And then there's another of you that are happy getting the care in the location that you're currently getting it and want to stay. Thank you very much. We use these opportunities in order to get a sense of how you all are feeling about some of the activities that we're pursuing here at the hospital, and it really means a lot to us for you to give us that feedback here. Our next update, we want to remind everybody that this month is Pride Month, and we want to remind all on the call that we're here to serve all of the served and want to ensure that all of our veterans are safe and welcomed at our facilities. For an update on our Pride Month activities, we welcome our LGBTQ+ Veterans Care Coordinator, Margot Edge. Margot.
Good afternoon. My name is Margot Edge, the facility's LGBTQ+ Veterans Care Coordinator. The LGBTQ+ Health Program wishes all LGBTQ+ folks a happy Pride Month. On June 1st, we raised the Pride flag on the main hospital campus, and you will see Pride lights at the Medical Center and at Rockford Clinic. We have been working hard to develop a great array of events for veterans and caregivers, as well as educational sessions for staff. If you missed us at the Rockford Pride Kickoff Party, we will also be at the Madison Juneteenth Festival this weekend at Penn Park on Saturday, June 17th, and in Janesville at the LGBTQ+ Education Summit at Blackhawk Technical College on June 22nd, which is an all-day event. On Friday, June 30th, from 9 a.m. to 1 p.m., we will have informational tables at the Rockford Clinic. Again, that's Friday, June 30th, from 9 to 1. The LGBTQ+ Health Program is working on many projects to improve and expand services for LGBTQ+ veterans. Recently, we established a Madison VA Hospital and Clinic's LGBTQ+ Veterans Gov Delivery email group, where you can receive up-to-date information on the LGBTQ+ Health Program, VA services, as well as community and VA events. We also created a new My Health Event triage group for active patients as another way for you to communicate with us. The group is MAD LGBTQ plus spelled out PLUS @ Again, that's MAD, M-A-D, LGBTQ PLUS @ Speaking of services, we have launched a virtual Pride in All Who Serve health promotion group. Topics include identity continuums, VA and military culture, relationships, family, and community resources. If you are interested in learning more about this group or other services, you can ask your provider for a referral or contact your LGBTQ+ Veterans Care Coordinator at 608-256-1901, extension 10762. Again, that phone number is 608-256-1901, extension 10762.
All right. Well, thank you, Margot, very much. It's very important that we celebrate Special Emphasis Month, like Pride Month, by specifically acknowledging and making efforts to ensure that veterans and special emphasis groups know that our hospital is for all veterans and that all veterans are welcome here, where we honor their service with high quality and compassionate healthcare services. Thank you all for your efforts to make sure all veterans are welcome at our hospital and clinics. Next, we have an update on the PACT Act. Chief of Staff, Dr. Ryan Marsh, has that update. Dr. Marsh.
Thanks, Abe. Thanks so much for having me here today. As a reminder, the PACT Act is a new law officially titled the Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxins, or PACT Act, and it represents perhaps the largest expansion of health care and benefits in VA's history. The PACT Act expands and extends eligibility for VA health care for veterans with toxic exposures and veterans of the Vietnam, Gulf War, and post-9/11 eras. It adds more than 20 presumptive conditions for burn pit, Agent Orange, and other toxic exposures. It requires VA to provide toxic exposure screening to every veteran enrolled in the VA health care. And it expands benefits available for illnesses resulting from toxic exposures. We know there are millions of veterans and survivors across America who are eligible for new health care and benefits as a result of the PACT Act, and we are making every effort to ensure broad understanding of what the PACT Act includes so that everyone who is covered understands how they can access the benefits and services they have earned. We certainly encourage all of you to let your fellow veterans know about these benefits and to encourage them to connect with the VA if they are not already receiving care or benefits. As an update on our progress, we have already completed over 20,700 of these screens. If you have not yet been screened, you should expect that before your next primary care appointment, the nursing staff will ask if you believe you have experienced any toxic exposures, including open burn pits, airborne hazards, Gulf War-related exposures, Agent Orange, radiation, Camp Lejeune, or any other exposures. This will give you an opportunity to report any concerns you might have, which will then prompt further screening either by your primary care provider or an environmental health staff. This will give you an opportunity to have further discussions about any issues and again allow us to connect you with resources such as the Registry Clinic, the Veterans Benefits Administration, Toxic Exposure Navigators, or your County Veterans Service Officer. There could also be further testing or treatment if indicated by your primary care provider or specialist if needed. We hope to use the screening process as a starting point to address any toxic exposures you may have experienced. You can discuss your specific concerns or learn more about the PACT Act and apply using www.va.gov/PACT or calling 1-800-MY-VA-411 or 1-800-698-2411. Or if you have questions about toxic exposures that have not already been addressed, please reach out to your primary care team to report your concerns. Thanks, Abe.
Thank you, Dr. Marsh. And as we mentioned earlier, the PACT Act and the availability of these services and new eligibilities for veterans is something that we're really trying to promote, and we need you all's help in making others aware of these new benefits. So please do spread the word to other veterans, and if we're taking good care of you here, spread the word about the good services that we provide. Those are the end of our updates, and we have several of you in the queue for questions. So we'll begin the Q&A session now, and we'll start with Wayne. Wayne, you have a question about your prescriptions.
Okay. I have a hard time navigating the prescription system at the VA because I have an outside provider, and then it always has to be approved by a provider in the system. Now, the PA, Roxanne Corvan, she's wonderful. I've dealt with her. But to get to her to get changes made is almost impossible because I keep getting sent to the pharmacy and back to One Science One, and I never get a hold of her where I can talk to her. So I'd like to have it where I can have some availability to talk to her to get the changes made that I need. Now, I need a prescription for pain pills because I just had my knee surgery last Friday, and I've used up more pain pills than I use it at my discretion for the pain, and I'm going to need some more within 2 days. So that's where I'm at right now. Is that possible to work on that where I can have availability to the person that gives permission?
Hi, this is Rochelle Carlson. I'm the Chief of the Primary Care Service. Thank you for your question. I just wanted to ask you a clarifying question. The provider that you see outside of the VA, is that a provider that you have been assigned through our community care department, or is that someone that you have just seen on your own?
That's someone that I've seen on my own for years.
Okay, thank you. So the reason I ask is our processes are a little bit different for those situations. When you see a provider on your own, you are correct that information about those prescriptions needs to come to your primary care provider. Your primary care provider then will review the documentation and notes from your outside doctor before they can prescribe the pain medicine. And we, in the VA, we know it can take a while, so we have up to 30 days for that process to occur. And so I'd encourage you to continue to reach out to your PAC team to give them that information.
Every time I call the VA, I get sent to a different department, and they keep sending me back and forth instead of answering my questions. Send me to the pharmacy, back to Science One. I'd like to talk to Roxanne. She's not available, and then go around the circle a few more times.
Apologies that you've had some difficulty with the phone numbers. Now, I could certainly, are we able to get any information?
I have somebody I had my surgery done in Sauk Prairie. Sauk Prairie has to send it to my provider. They also send it to Roxanne, the PA, at the VA. But I haven't got contact. I need these pills within probably 3 days or I'm going to be out. And then I just live with the pain, because I'm going to be doing therapy for 6 weeks now. And I think the pain get less as time goes on, but why should it when I have access to And I can see why they're controlled substances. I can see why there's the safety nets in place, but I need to get through to talk to somebody.
Right. We can help you get through to talk with somebody. I do also want to just add that if you did have surgery from somebody else and you're still having pain, it would be best to go back to that provider and let them know about your pain.
And Wayne, we'll also look at your information and make sure we take a look at your case and get back to you, okay? And now we'll move on to the next question, but really appreciate that one. And the next veteran we have on the line is Guy from Baraboo. Guy, please state your question.
Hello.
Hi, how are you today? We can hear you.
Well, pretty good. My question, I've always, or very seldom have used VA. I've had a provider here for the last 30-some years, through St. Clair. But now that I am legally blind and losing my hearing, I just want to know if that, what they would have available for me for the blindness.
Sure. Hi, this is Liana. I'm the Chief of the Patient Administration Services. Well, I would advise you to get in contact with your social work in your PAC team, and then the social worker can assist you with applying for the catastrophically disabled benefits. They will assist you with the paperwork. Our eligibility department will receive that paperwork. We'll get it through the process of getting a review, and once the determination has been made, if it's favorable, you will be placed in a different priority group. Legally blindness, it is one of the qualifying factors, so I would definitely advise you to do that.
Would you say that slower again? Like I say, I'm very hard of hearing.
Sure. So I will advise you to contact your social work, the social worker in your PAC team. Contact your PAC team where you get your primary care. They have a social worker there. When you contact your social worker, let them know that you will like to apply for the catastrophically disabled eligibility and benefits. They will assist you with the paperwork. Our eligibility department will receive that paperwork and will get it through the review process. Once the determination has been made, if it is favorable to you, you will be placed in a different priority group, which is exempt from co-payments. Legally blindness, it is a qualifying factor. So again, I definitely encourage you to reach out to your social worker.
Now, one question, the blindness is not, as far as I know, connected with the military.
Correct. So this is why we have that determination for veterans once they're out.
Okay, I will do that then.
Thank you so much for calling us today.
Thank you, Guy, and thank you, Liana. Our next caller is Chris. Chris from Rio. Please join us with your question.
Yes, my question concerns the PACT Act and the burn pit screening. What kind of education is going on for primary care providers to let them know not only of what the acts or what the screenings are involved, but how to actually request those screenings? I ask that because I saw my primary care. I mentioned that I would like both screenings, and I've heard absolutely nothing since then, and that was well over a month ago.
Sure. Hey, this is Dr. Marsh. Hey, so I'm sorry that that's happening. We have done, since the PACT Act went into effect, I believe it was last August or September, we've done a lot of education in the primary care departments, meetings with the departments. All staff are required to do training, computer training on it, and then we're aggressively, like we mentioned at the beginning of the call, about over 20,000 people have been screened. So I'm sorry that that's happening. We can get his information, right?
Mm-hmm.
yeah, we can get you information and we can follow up with you about that.
Yeah, well, clearly the primary care providers actually need that information because she knew nothing about what to do to request the screening. So, something is not working here.
Yeah, and again, I'm sorry that happened. It might have been a new provider. I'm not sure what happened in your particular case, but we will definitely follow up on that.
Yeah, I think, Chris, to your question, there are always challenges in making sure everyone in a large organization knows everything. So getting those kind of inquiries like yours helps us to reiterate the education and get the message out so that it's consistent across the enterprise. But we'll follow up on your issue. Thank you very much for raising it. Our next caller is David. David, do you have a question about Medicaid? I think, David, we can barely hear you. Can you get closer to your phone mic, maybe? I think, David, maybe we'll come back to you because we can't hear your question. We'll try to come back to you and answer your question later in the call, and take your name and follow up with you as needed. Let's see. Our next question comes from. We're just working on a little technical issue here, folks. Okay, our next question is from Todd. Todd, you have a question about the Baraboo expansion. Please proceed with your question.
Yes. Yesterday, I had an urgent care appointment on a follow-up from my physical, and I actually saw a doctor instead of an LPN. Is there plans on adding more doctors to the Baraboo clinic, or are we still going to, primary care providers going to be LPNs?
Hi, this is Rochelle, the Chief of Primary Care, and I wanted to let you know at our Baraboo site, we currently have 4 primary care teams. One of those teams is led by a physician, one is led by a physician assistant, and 2 are led by nurse practitioners. We do not have any plans right now to add any additional teams. All those teams will be going to the new site and will be providing care. We occasionally do have providers from float to that clinic to help with coverage, and you may have seen one of the float providers who was a physician yesterday.
All right. Where is this East Side clinic going to be located?
Hi, this is Crystal Warning. I'm the Chief Strategy and Planning Officer. So the East VA clinic is going to be located at, if you're familiar with the American Center, there's like a UW hospital out there now.
Yep.
It's right out there. It's at 4904 East Park Boulevard in Madison. So it's right off of the highway there.
Yep. All right. So for where I live, it'll be a horse apiece for Baraboo, Beaver Dam, or East. So I guess I'll transfer to East.
We'll be happy to have you there when we open next summer. Thanks for the call. Our next caller is Philip. Philip has another question about expansion, but to a different area. Philip, go ahead with your question.
Yeah, I was wondering if they're planning on putting a VA out here somewhere in the west side of the state of Wisconsin. I live in Highland, Wisconsin, which is on the other side of Dodgeville by 20 miles. I already drive 20 miles to the store and 20 miles back every time I go to the store because we don't have a store in Highland anymore. But I was wondering if they're planning on doing anything out west, out this way, where all the farmers are, where we're doing our thing.
This is Crystal again, the Chief Strategy and Planning Officer. That's a great question. So, we've got several outpatient clinics, and East Clinic is actually our newest clinic. It's a brand new site of care. We don't currently have any plans to add additional clinics to our catchment area. This really is, that kind of approval comes from national, and it's based upon how many veterans we have and where they live and, how many veterans we're going to have sort of in the future. But one thing that we do when we are evaluating the location of a clinic, when we're ready to renew a lease or replace move a clinic to a better location, is we take a look at the different places where our veterans who are receiving care at that clinic live. And so we will be doing that with the West Clinic in a few years when it comes time to start planning for potentially finding a new clinic location for the West Clinic. And in some of our preliminary analysis that we did for the East Clinic, we did note that potentially adjusting the location of the West Clinic to be a little bit more southwest might be more accessible to a lot of our veterans. So, this is probably not going to happen for several years, but there is a possibility that our clinic could move a little bit further in the location where you are, and so you don't have to drive quite as long to access your care.
Okay, can they actually do something about the travel vouchers then for travel pay? They have it so messed up. I can't even get it on my phone because I've got a Verizon. And they said, well, we tried it several times, send in for travel pay from here to there and back, but it's better if I just fill out the paperwork there, or if they could just, when I do my visit and they know I'm there, I'm checked in, could they just send a tweet over to the people for travel pay so I could get it that way instead of going through all the stuff I have to go through now?
Yeah, this is Liana, the Chief of Patient Administration Services. I apologize for the inconvenience with the travel pay. We realized that it has been cumbersome for veterans when we transition to the new system. Definitely the veterans that have the preference to fill out the paper forms, they will still have that option. I'm pretty sure that we'll set up a drop-off box to get those from the veterans, and then they will process manually. It will take a little bit longer, but definitely it's still an option.
Yeah, thank you for the question. And whenever we transition between systems, there's always some disruption. And travel is also an area where we have had some recent difficulties hiring. So we're working very hard in order to restaff that process so that we can provide as consistent service as you all expect and deserve. So it's another area of us for continuous improvement. Our next caller on the line is Tom, and Tom has a question about traveling. Tom, go ahead with your question.
I travel between Wisconsin and Texas in the winter, and I get good coverage when I'm down the lower Rio Grande Valley to McAllen. And when I'm south of Houston and Lake Jackson, nothing. They have a VA office there, and when I checked in, they took my card and looked at me like I was from outer space, and I couldn't get coverage. I checked with the traveling coordinator, and she came back and said, well, there's nothing I can do. So I just wondered if there was some way to get service there.
Hi, Tom. This is Liana, the Chief of Patient Administration Services. I'm sorry for the difficulties that you have experienced continuing with your care while you're traveling. One thing that I do want to let you know is that the West Coast, to include Texas, is under a different contractor for community care, which it precludes us from setting you up with a provider when you're traveling. So my advice to you is to contact your primary care provider so they can set you up with a traveling veteran coordinator here in Madison, and then that person will, the traveling veteran coordinator will reach out to the traveling veteran coordinator of the VA that is closest to where you're going to be staying during the winter, and then they can figure out your care. That they need to establish the coordination. That is the process for everybody. Unfortunately, for the veterans that go to the West Coast, it's more difficult for us because we don't have the option of setting you up with a provider in the community because we don't have access to that network because we are under a different contract.
Okay. And I live in Winneconne, and I opted to go to Beaver Dam, and because I wanted to get to Madison. I was just wondering if there's any way to go to Appleton and still get coverage in Madison.
If you're switching, if you're wanting to switch your primary care provider, Appleton belongs to Milwaukee, so you will have to contact again your primary care provider, and they will put in a consult for that, and then it will be addressed by the Appleton CBOC staff.
But I would have to go to Milwaukee.
So for your specialty care, that what is not provided in Appleton, it will be defaulted to Milwaukee, correct? I mean, everything with ACT eligibilities will still apply, but then you will belong to Milwaukee VA facilities.
Okay, thank you very much.
Yeah.
And we certainly encourage you to stay with us. As good a service as Milwaukee provides, we certainly are very proud of what we do here, and we're hoping to retain as many of you as possible in our care and to add to those numbers. The next question we have comes from Tim, and Tim has a question about the new East Clinic. Go ahead, Tim.
Yeah, how you doing?
Great.
The East Clinic sounds great because I live in Lake Mills, so currently I use the West Clinic, so the East Clinic will really be great. My question is, well, I have to change doctors now. I have Dr. Agarwal at the West Clinic, who I've had for 3 years now, so am I going to have to get a new doctor if I use the East, or do they kind of go back and forth?
Hey, Tim, this is Crystal. Thank you for that question. I think there's a couple other people that have a similar question. So when we open East Clinic, you're correct that several of the West Clinic providers will be moving to the East Clinic. Those announcements have not been made, but you will find out where your provider will be located in mid-January. All of the existing West Clinic patients will receive a letter letting you know where your provider will be located. If you would like to choose to keep your provider and go to that new location, you can do that. If you alternatively would like to choose to at West and or go to East and switch providers, we'll provide you with that process of how to do that at that time.
Oh, okay. Okay, and also I just want to say I've been using the VA since I retired, which was 3 years ago, and I got to tell you, it's the best care and service I've ever had from any civilian provider. It's just unbelievable. So thank you very much.
Thank you, Tim, for that feedback.
Yeah, thank you very much, Tim. And we look forward to many of you on the call to reaching out to you in the coming months as we get closer to the East Clinic activation to provide notifications about updates and to work with you in order to make sure that we align your care with our new clinic structure. So it was a great question and a conversation we look forward to having in the coming months. The next caller we have is Terry from Adams. Terry, go ahead with your question.
Hello?
Terry, you're on the line.
Oh, okay. Sorry, it just said it's my turn. And yeah, my name is Terry, and my question is the expansion at the Baraboo location, will they be providing chiropractic care there at all in this expansion?
Hi, Terry. This is Rochelle, the Chief of Primary Care. That's a great question. Right now, we currently are not planning on providing on-site chiropractic care with the Baraboo expansion, but that is something that we will continue to assess the need for and, make changes if needed. We do have on-site chiropractic care at our West Clinic right now.
Okay, and that, yeah, I'm actually farther north, but I work in Reedsburg, so for me, the Baraboo Clinic is close. So, I mean, I do appreciate all the care though, because I did have a procedure done at the hospital in Madison, and it was excellent. The people were great. Everything was great there. So, like I said, I was just curious if that was going to be something at Baraboo that they would offer, in the future, or if there's something that works or plans.
Well, thank you so much. We're glad you're here. You had a good experience, and we will certainly continue to assess the need there in Baraboo.
Thank you, Terry. Appreciate that positive feedback. We love hearing that. Next caller in our queue is Aaron. Aaron, you have a question about the PACT Act.
Yes. I'm just wondering if there's been progress, or if we know of progress that's being made in getting a presumptive claim for sleep apnea as it relates to the toxic exposures.
Hey, this is Dr. Marsh. Hey, thanks. Get that question quite a bit about sleep apnea. So right now, I have not heard of anything, but that doesn't mean much. Quite frankly, those are dealt with at a central level in Washington typically. And part of the PACT Act, we are required to do more research. And so even if it's not going to be something right now, it's possible in the future that it will be. So I would just say keep up with that. If you haven't been part of our registry yet, I'd encourage you to do so. As we see more people in the registry with that diagnosis, that will prompt more research into that as well.
Yeah, I've had the diagnosis. I'm in the registry, and I've done everything else with it. It's just the military doesn't ever want to take any claim with any aspect of sleep apnea. It's been the hardest struggle I've had for the last 7 years.
I'm sorry that's happening. So there's always appeals that you can do, and sometimes you can use other routes to do sleep apnea claims. Certainly, we see a lot of those. So that would be something to work with your county veteran service officer. It sounds like you've probably already been doing that.
Thank you.
Thanks very much for that question. We have another question on the PACT Act. This one is from James in Stoughton. James, please raise your question.
Oh, my question is about the PACT Act. Does it cover Cold War vets at all? Because, we did burn diesel fuel to keep warm with in the winter. We also, in the field artillery, burned gunpowder in pits and was exposed to that type of smoke. So does it cover our Cold War vets also?
So this is Dr. Marsh. It's a great question. So I think you're really asking is could you get service connection for something for airborne exposures that you had as a Cold War veteran? Am I hearing that correctly?
Basically.
Yeah. So I have had this question quite a few times. So not eligible for the registry. You can always make a claim regardless of what the PACT Act says about exposures that you say that you had and conditions that you feel are related. I can't say for sure. I don't think the PACT Act extends to that because of specific limitations of where you need to serve. So I don't think that will be covered. But again, you can make a claim for anything, and I encourage you to talk to your county veteran service officer to see if that might be an option for you.
Okay, thank you.
Yep.
Thanks very much for the question. Our next question comes from Walter in Fond du Lac. Walter, you have a question about community care eligibility?
Yes, thank you. Hello. It pertains to distances, say, my residence to the Seebach and Beaver Dam. And there was a time in the beginning that distance was measured in miles. Now it's measured in minutes. 60 minutes and I present as a 73-year-old 100%er, 21 years, best care at the VA ever. I prefer Middleton over Zablocki, and I've been inpatients in both facilities. That's just a personal thing, but I'm having trouble. I want to have my video connect appointment with my primary care, and then I want to go over to the laboratory in the hospital here, St. Agnes Hospital, to have my blood drawn for lab work, and I'm being denied that. Well, I had been approved for that previously. Not that it's a precedent that I went over there and had this done once, but I can't even get the attention of my primary care provider I feel that way anyway. I mean, that's perception. As I said, they're great caregivers. But did it go from miles to minutes?
Hi, Walter. This is Liana, the Chief of Patient Administration Services. Yes, it did. When the CHOICE Act was implemented and signed into a law in October of 2014, one of the eligibilities was 40 miles eligibility for veterans. In that change, the CHOICE Act was ended once Mission Act went into effect in June 6th of 2019. And Mission Act, one of the qualifying criteria for community care is drive times for specialty care of 60 minutes. I've seen quite a few veterans from the Fond du Lac area that share that burden. They are closer to our CBOC in Beaver Dam, and but then their specialty care, they're closer to Milwaukee, closer than Madison. So I do see that, unfortunately, because you are not within 60 minutes drive time from Milwaukee, you are not eligible for specialty care. I understand that in the past they may have approved you for community care, and who knows if the services were not available at the time, if there was another qualifying factor, another consideration that your doctor, when they put in the request, went to the chief of staff and they made that determination. But the rule, based on how the law was signed, it will not make you eligible.
Well, that stinks. Thank you for that explanation. Operating a motor vehicle, I'm 73, and I guess that's young for the older years in life. So a young 73, I would like to think, but I don't enjoy driving like past 25 or 40 miles an hour in town here in Fond du Lac to go here or go there. I sometimes sit in my living room for 5 months without going outside. I just feel that it's not safe for me to operate a motor vehicle to go to Beaver Dam at this time, and I'm asking to let me see the doctor or nurse practitioner, my primary, on Video Connect, and then go over to the local consultant's laboratory in St. Agnes Hospital and let them do the blood draws, and at least I get my primary care visit and I get my laboratory results. And then I both want them and need them.
Walter, we certainly sympathize with your concerns. And one of the hard things about working in a system like ours is that we are governed by laws, but there are always follow-up inquiries we can do, and one of the things that maybe we'll try to do is get you connected with our patient advocates so that we can better understand some of the challenges that you're facing and identify whether there are other pathways for you. But thank you for the question, and really appreciate the second time someone said that the care at Madison is better than the care at Milwaukee. So thanks all. We have time for one more question, and the question is from James in Watertown. James, go ahead with your question.
Yeah, I'm really pleased to be a veteran that uses the Madison facilities. I belong to the old age chapter of the 101st, and we talk about the VSOs and all of the services that we get from around the area. And I think we in the Madison area have the best services. So I want to write a letter to somebody and compliment you guys on the good work that you do. Who should I address that letter to?
First, thank you, James, so much for that compliment, and we always love receiving letters like that. If you just want to address that letter to the director of the hospital, one of the things that we do when we get complimentary letters like that is we share them with all of the staff because it really helps all of us who are doing the hard work of providing health care to veterans every day. A lot of energy and enthusiasm when we get letters like that from veterans who are complimentary of the care that they receive. So just if you wanted the address for that letter, you can go on our website, www.va.gov, Madison Healthcare, or the address for our facility is 2500 Overlook Terrace, Madison, Wisconsin, 53705. But if you just address that to the director, it'll come right to our front office, and we'll look forward to getting that from you and appreciate the compliment. So thank you very much to all of you for joining us this afternoon. We had a lot of really great questions and back and forth. We have a couple issues to follow up on, but we were so excited to share news about expansions that are coming to your service area. For those of you, if we didn't get to your question, please stay on the line. You will have an opportunity to leave a voicemail with your questions, comments, or feedback. Also, if you have a question that didn't get answered, we just encourage you to call our operator and ask for the patient advocate. If you're not having trouble finding somebody, we'll make sure that we connect you with the right people so that we make sure that we're taking good care of you and get your questions answered. And just a couple quick reminders. We just want to really make sure that everyone remembers that website for the PACT Act, www.va.gov/PACT, and to really talk to your fellow veterans about the care that you're receiving at the VA and the opportunities to connect with us if they're not connected already. Thank you all for joining us this afternoon. We hope you look forward to future town halls on new topics, and we wish you all a wonderful rest of your afternoon and summer. Thank you very much.